doing your assessment. Okay, I'm going to start with your head. I'm checking for symmetry. I'm going to be palpating. Okay, feeling for any masses or lumps, inspecting for any scarring. Okay, I'm going to be checking your temporal pulses. All right. Next, I'm going to be checking your cranial nerves. I'm going to ask you to raise your eyebrows. Okay. I'm going to ask you to frown. Okay. I'm going to ask you to close your eyes tightly. Open them. Okay, great. I'm going to ask you to smile and show your teeth. Okay, and puff out your cheeks. Okay. Next, I'm going to be checking your masseter and your temporal muscle. I'm going to ask you to open and clench tightly. Okay. Okay. And I'm checking for any clicking or any discomfort. I didn't hear any clicking. Did you have any discomfort? Okay. Next, I'm going to perform my cotton wisp test. I'm going to ask you to close your eyes. Wherever you feel the cotton touch you, I want you to say now.
Okay. No. 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 No.
And was the sensation equal?
Yes.
On both sides? Each
Yeah.
side of, okay. All right. Next, I'm going to be checking the external structures of your eyes. Your eyebrows are symmetrical. Your eyelashes are intact. I'm going to pull your eyelids down. Take a look. Look to your left for me. Okay. Look to your right. Okay. All right. So that's good. Next, I'm going to be checking your cranial nerves. I'm going to be checking for accommodation, convergence, and EOMs. I want you to follow my finger with your eyes only. Okay.
Okay.
And I'm checking for nystagmus and tracking. Okay. Next, I'm going to dim the light, and I'm going to have you look directly ahead, straight ahead. And I'm going to be checking direct and consensual constriction. Okay, great. Next, I'm going to be checking your eye with my ophthalmoscope. Okay, I'm going to be starting with my right hand to your right eye. Okay, my right eye, I'm going to be starting 12 inches away, shining the light in your eye. Okay, and I'm going medial, and I'm looking at the disc and cup. And then I'm going lateral, and I'm looking at the fovea and the macula. I'm going to do the same with this light here on this opposite side. Okay, so I'm coming in, and I'm going medial, and I'm looking at the disc and cup, and then I'm going lateral, and I'm looking at the fovea and macula. Okay. Next, I'm going to be checking your ears. Okay, for symmetry, palpating for symmetry, no scarring. Okay, I'm going to be conducting a whisper test. Okay, I'm going to occlude your ear, and I want you to repeat the words that you hear.
Cat.
Rat.
Rat. Bat. At. Mat. Cat.
Okay, great. Next, I'm going to be examining your ear. Okay.
Okay.
I'm going to use my otoscope. I'm going to pull the ear out, back, and up. Checking the ear canal for any drainage, the tympanic membrane that's pearly green intact. I'm going to do the same here. I'm going to go out, back, and up. No drainage in the canal, and the TM is pearly gray and intact. Next, I'm going to be inspecting your nose for symmetry, no deviation. I'm going to include this nostril here. I want you to take a deep breath in. Okay. Okay, great. Next, I'm going to shine a light into your nostrils. Okay. Just checking the mucosa and your turbinates. Okay, great. Next, I'm going to be checking your mouth. Okay. All right. I'm looking for your lips are symmetrical. Open for me. All right. I'm looking at the gums. I'm checking the buccal mucosa. Lift your tongue. I'm checking the soft palate. Put your tongue down. I'm checking the hard palate. Stick your tongue out for me. Say ah.
Ah.
Okay, great.
Ah.
Uvula and posterior pharynx. Okay. Great. Next, I'm going to be inspecting for symmetry here. I'm going to be palpating your preauricular lymph nodes, post-auricular nodes, posterior, doing deep clavicular nodes. I'm checking your submandibular and submental. I'm checking supraclavicular nodes, no Virchow's nodes palpated. Next, I'm going to have you shrug your shoulders. Shrug your shoulders. Okay. All right. Next, I'm going to be inspecting your trachea, making sure it's midline and intact. I'm going to have you take a sip of water for me. And I'll tell you when to swallow. Hold it. Turn around. Turn around. Okay. I'm going to locate my landmark. Tilt your head forward and to the right. Okay. And swallow. Great. I'm going to do the same on the opposite side. Have a sip of water for me, please. Hold it. All right. And we're going to do the same. I'm going to palpate my landmark. Okay. And I'm going to have you tilt your head forward and to the left. Okay. And swallow. Okay. Next, I'm going to be doing your respiratory assessment. We're going to observe, inspect the skin. No scarring. Okay. And the color is good. All right. I'm going to be percussing. Lift your arm for me. Okay. And I'm going to be going posterior. And I'll be doing the same thing. Turn this way. I'm going to be listening. Okay. Whenever my stethoscope moves, I want you to take a deep breath in. Okay. Deep breath. Okay. Turn around for me. Okay, let's go in. Out. Next, I'm going to I'm going to be doing your cardiovascular assessment. Okay, I'm going to use the bell of my stethoscope, and I'm going to listen to your carotids. Okay.
Okay.
First, I'm going to start by palpating your carotid, one at a time. Okay, great. Next, I'm going to listen. Okay, I'm going to have you take a deep breath in and hold it. Take a deep breath in, hold it. Okay, out. Deep breath in. And out. Okay. I'm going to have you lean forward, and I'm inspecting for heaves and palpations. Okay. All right, sit upright. I'm going to take a listen to your heart. Okay.
Okay.
Okay, I'm also going to do that with the bell of my stethoscope.
Okay.
Okay. And I'm going to have you lay down. And I'm going to do the same. Okay.
Okay.
And again with the bell of my stethoscope. Okay, great. I'm also going to be doing your gastrointestinal assessment. Okay, I'm just going to pull it down. I'm going to be inspecting the abdomen. Okay. And then I'm going to be auscultating. I'm going to take a listen to make sure that you have bowel sounds present. Positive bowel sounds. Okay. I'm going to be percussing. Okay, I'm also going to be percussing for the liver border. Okay, I'm going to have you take a deep breath in and out. All right, and I'm palpating. And I'm going to deep palpations throughout the rest of the abdomen. Any pain or discomfort anywhere?
Mm.
Okay. Then I'm going to be doing your peripheral vascular assessment. Okay, I'm going to be inspecting the skin and checking warmth. Okay. All right. I'm also going to be looking at your fingertips and checking the capillary refills here. I'm going to be checking your pulses, brachial pulses, and radial pulses. Okay. I'm going to do the same with your legs. Okay. I'm going to be taking a look, checking both legs, and checking warmth in both legs, and also checking for edema. Okay. All right. I'm going to be checking your pulses. I'm going to start by checking the femoral pulse. Okay, I'm going to ask you to bend your knees I'm going to be checking about a 30-degree angle. I'll be checking the popliteal pulse here. Then I get down, I'm going to be checking the posterior tib pulse and posterior tib pulse on the opposite. Then I'm going to be checking the pedal pulse, dorsalis pedis, and dorsalis pedis pulse, and checking for cap refill on the toes. Thank you.